Right, thank you for the introduction, and also thank you for inviting me to this forum. I'm Robbert Boudewijns. I'm coordinator for One Health at KU Leuven, and soon hope to be the manager of the One Health Institute at KU Leuven. I was asked today to give you a summary of the 3 webinars that were held last week. You may think, well, that's sort of pointless because
Robbert,
obviously...
Just wait a minute, increase the volume on the speakers.
Yeah. Yeah? Well, you may think that's sort of pointless because obviously every single one of you has seen all of the 3 webinars, but just in case you forgot something, I will guide you through those webinars. So also thank you to the 3 speakers of last week to give us these 3 interesting webinars. So I wanted to start with the definition of the One Health, which is a quite dry definition. It's quite comprehensive. It's been defined by 4 major organizations, international organizations, linked to the United Nations, to the United Nations Environmental Programme, the WHO, FAO, and the World Organization for Animal Health. So the definition I've divided into 3 parts. First, we have One Health aims to optimize the health of people, animals, and ecosystems. And it recognizes that the health of these 3 things is closely linked and interdependent. Over time, people have tried to put this definition into a figure, and they've made many attempts, mostly being one of these 2. These sort of represents the 2 schools of thought behind One Health. So you could see One Health as only this part that in which the health of humans, animals, and the environment really overlaps. But I'm more fond of the second view of One Health, in which you see that the health of all living beings is within the One Health context. Although I think both of these figures are in a way flawed, because also in the second figure you still have these boundaries between the 3 domains, whereas the One Health philosophy is basically to break down these barriers, to have everything inside the One Health circle. And the approach mobilizes multiple disciplines, sectors, and communities at varying levels of society to work together. So disciplines, meaning academic disciplines, so everyone is involved, from biosciences to biomedical sciences, social sciences, engineering, and so on. So this is more on academic level, interdisciplinarity, but also transdisciplinarity, and you can see the definition of Leroux of transdisciplinarity here. On top of interdisciplinarity, it also contains the collaboration between academic institutions and other actors, so meaning policymakers, but also civil societies, the industry, and so on. So it's the One Health approach is not just interdisciplinary on an academic level, but it's truly transdisciplinary as well. And then the last part of the definition, to foster well-being and tackle threats to health and ecosystems while addressing the collective need for all of these things and contributing to sustainable development. And when we see sustainable development, obviously this rings a bell. We know the sustainable development goals that have been defined by the United Nations. And if you look closely to the definition of One Health, you can see that almost all of these sustainable development goals have been included in the definition of One Health. And it should really be no wonder, since the One Health definition was also defined by 4 United Nations related organizations. So we've gone through the definition, but this may still be quite vague. So what is actually the One Health approach? Well, I've prepare an example, in this case, for a zoonotic spillover event. Take, for example, the COVID pandemic. We've all experienced this. But what happened is, in case of a spillover event, we only act after the spillover event occurs. And then we try to do everything in our power to stop transmission between humans of a virus or another pathogen by any means necessary. So we have medical interventions, but also a mouth mask, for example, or quarantine. So this is a more classical medical approach to health. With the One Health approach, we also like to take a look back at what happens before the spillover event and all of the things that are essential and contributing to this spillover. For example, we as humans, we encroach on natural habitats of animals, we trade exotic pets, we eat bushmeat, we cause biodiversity loss, and all of these things are also influenced by urbanization, pollution, climate change, which also leads back to a rise in population. So the One Health approach really takes a holistic view at all of these different factors that contribute to spillover, not just at the spillover event itself, but also way before that. So a One Health approach really emphasizes the prevention. Okay, so how will we implement a One Health approach into society and science? Well, luckily there's been many people who have asked the same thing. For example, the One Health high-level expert panel, they have set up 3 pathways of change in 2022. And these pathways are policy, advocacy, and financing first, then organizational development, implementation, and sectoral integration of a One Health approach. And then the third pathway is the scientific evidence, so data, evidence, also education and knowledge exchange. And these pathways are then divided into high-level actions that can be taken to implement a One Health approach. Also, the quadripartite, so the group of these 4 major international organizations. Also in 2022, they have set up a One Health joint plan of action with 6 action tracks. Also, the 3 pathways defined by the expert panel have been included in this action plan. The first action track consists of enhancing One Health capacities to strengthen health systems. Then we have 4 action tracks that are more thematic, so focusing on zoonotic epidemics and pandemics, tropical and vector-borne diseases, food safety and antimicrobial resistance. And then the final action track 6, is integrating the environment into One Health. Because the One Health definition was first defined by 3 parties, so the WHO, the FAO, and the World Health Organization for Animals. The environment part of One Health took the back seat, so now they are trying their best to also integrate One Health into, the environment into the One Health definition. The action plan also promotes cross-cutting principles. So we've talked about public-private partnerships, so getting industry involved, so this transdisciplinary approach. This transdisciplinary approach also means involving societies into decision-making, into science. Traditional knowledge of local and indigenous communities is very important in this respect. Systems thinking, so what you have seen with the spillover event, we try to look at a holistic view of what is happening, all different factors considered, to really get an idea of if we make changes to a system, how will it react? So systems thinking, systems modeling, to assist policymakers to make the right decisions. And also institutional frameworks. So, talking about institutional frameworks, we have the DG Santé, for example, that has included a One Health Directorate within the DG Santé to really help the DG Santé to focus on One Health topics, not just simply human health topics, but also to include and to safeguard a One Health approach within this Directorate General. Also, the CDC has a One Health office now, and within Europe, also the agencies. So here you see 5 agencies have set up a One Health cross-agency task force. And this brings me to the first presentation, the first webinar of Stef Bronsoir from EFSA. He introduced EFSA to us, but also the One Health cross-agency task force. And he mentioned that basically from a very early moment, EFSA was already a One Health organization. So already in 2002, we had the mission statement of EFSA stating that human life and health deserves a high level of protection, also animal health, welfare, animal health and welfare, plant health, and the environment. So already in 2002, they were really striving for a One Health approach. And it's only logical, since many of these crises that EFSA has to deal with, think of dioxin crisis or the mad cow disease, BSE, they are truly One Health topics. On top of this, EFSA also, it does not only take care of the food safety, but also of zoonosis and AMR. So they are also knowledge centers for these teams. Another issue is pollution of the environment. So we know plastic pollution of the oceans, which makes that microplastics and other pollutants finally end up in our food chain as well. So there's a lot of things that we do as humans that are detrimental to our own health in the end. So for quite some time, for several years, the EFSA has been working together with ECDC and the EMA to make a report every 3 years on antimicrobial resistance. So antimicrobial resistance is one of these key One Health themes, since it involves both human consumption of antibiotics. Of course, antibiotics use in agriculture is a big contributor to resistance. And all of these resistance genes and antibiotics will end up in the environment at some point. So all 3 factors of the One Health approach are very important in the AMR, in the theme of AMR. So this report, it's the JACRA report, released every 3 years. Also under the European Green Deal, which is basically the European translation of the SDGs, or Sustainable Development Goals, a number of strategies have been developed over the past years. So for example, we have the chemicals strategy for sustainability. We have the EU biodiversity strategy, the farm to fork strategy, which you obviously know about, the AMR action plan. And together with these strategies, the EU agencies have really pushed for taking up these European partnerships also within the Horizon Europe program to go together with each and every one of these strategies. So the European partnerships, they offer significant funding to bring together the most important players within each field on a certain topic to produce research that has ultimately an impact on policy. So the agencies are getting more and more involved also in these partnerships. At the end of 2022, there was the One conference, where all different relevant stakeholders for the One Health approach in Europe were present, so policymakers, the agencies, also scientists. And this was a unique opportunity for the agencies to meet each other. And one of the most important outcomes of this conference was setting up of a One Health agency, cross-agency task force. This setting up of a cross-agency task force, it makes sense since the agencies are really knowledge centers of the union. They know what the research needs are, so it's only natural that they would team up to talk about One Health, and they want to use this cross-agency task force to define the research needs and to get involved in the programming of the research framework programs of the EU. There are several tasks that the cross-agency task force takes up. For example, we talked about the research coordination, so trying to get involved in the definition of the framework programs. Also stakeholder engagement, so from policymakers to civil societies. The agencies are very well connected with all of these different actors, so they are the excellent starting point for this. And they also want to organize joint activities. So we have talked about the One Health Cross-Agency Task Force, which is on the EU level. The next webinar of Annemarie Rebel from the University of Wageningen gave us a more a study case or a case study on One Health implementation on a national level. So what Annemarie presented was the National Center for One Health in the Netherlands. Why is this relevant for the Netherlands? Well, the Netherlands has its own set of One Health issues. As you may know, the Netherlands is the top 2 food producer in the world, not just per capita, but in absolute numbers. So this means that there's a lot of livestock, meaning also a lot of risk of zoonotic exchange. Nitrogen pollution has been in the news in the Netherlands over the last year for a very long time. Also the use of antibiotics, of course. Here you can see a bit of the representation of a farm. Of course, I do not need to explain this to you, that there's a lot of exchange, or at least potential for exchange between the environment, the animals, and society. A couple of examples, especially for the Dutch case: avian influenza, AMR, African swine fever. This year they have a lot of sheep farms that have been terrorized by blue tongue virus. So a lot of One Health topics that are very relevant to the Dutch situation. Also, when we talk about the environment, you may know that there's a lot of nitrogen pollution in the news, or at least nitrogen policy or regulations within the Dutch politics. They have created back in the day, a new province from basically nothing. So there's a lot of environmental changes in the Netherlands. So also here, the setting up of a One Health organization within the Netherlands is very relevant. Also, climate change, of course, happens everywhere. So this Netherlands Center for One Health, it consists of, or has defined different strategic research teams: AMR, infectious disease, healthy wildlife and ecosystems, and smart and healthy farming. And thanks to this center, because they were already well connected before the COVID outbreak, This really enhanced the ease of collaboration and also advice to the government in this situation for improved pandemic preparedness and response, not only for COVID, but also for the avian flu epidemic. Some of the activities of the One Health Center are listed here. So yearly events, also a big focus on young researchers, and digital outreach, so website, social media, and so on. The plans for next year have been defined as well. So the NCOH has come to a decision on the agenda for the next 5 years with overarching themes, emerging pandemic preparedness, which has several sub-themes. So these first 2 webinars of Steph and Annemarie, they fit within this first action track of the One Health Action Plan, the enhancing One Health capacities to strengthen health systems. Of course, the themes that they cover are covered by the action tracks 2 to 5, but we still have this action track 6, the introduction of the environment into One Health. And this is where the third webinar of Raf Aerts comes in. So Raf Aerts is affiliated to KU Leuven as a professor, but also to Cienzano, the National One Health Institute of Belgium. And he gave us an overview of what constitutes a healthy environment within the One Health context. And he divided his presentation up into 7 bullet points, which I will go over. So a healthy environment requires biodiversity and healthy ecosystems. Since this environment and the ecosystems, they provide ecosystem services to humans, to animals, to life in general. For example, provisioning of food, water, fuel, resources. Also regulating, so climate regulation, flood regulation, water purification, and also cultural meaning to us. So both spiritual, but recreational, for example, as well. And all of these things get under more and more pressure because of pollution, climate change. And one thing that we do not really realize, we think of biodiversity loss as the loss of large animals, but we should also think of the soil microbiota that are disappearing, that the species of the soil microbiota are dwindling, which also has a major effect on overall biodiversity and the regulating capacity of the environment. Then a healthy environment also requires prevention of spillovers of zoonotic diseases. So we went over this already. We encroach on animal territory, we trade animals or animal products, and this poses really a threat to zoonotic events. So also number 3 talks about infectious disease, more specifically on vector-borne diseases. When we think of vector-borne diseases, we mostly think of ticks or mosquitoes, but also birds have been known to be able to spread pathogens, and we know through climate change that also the migration pathways or migration paths of birds are changing, so this could also have an effect on the spread of vector-borne disease. With this figure, we also want to stress one more time on the fact that we focus on spillover events, but also way before the spillover, which you can see in the orange line, we should already think about prevention of zoonotic spillovers. Then a healthy environment also resists natural disasters such as floods or wildfires, with people prepared to respond. And it also requires efforts to minimize exposure to persistent pollutants. Persistent pollutants meaning, for example, pesticides or PFAS, which is now a big deal, for example, in Belgium. It's been in the news many times. The sixth point, the environment, a healthy environment also requires healthy food systems. If we look at the agricultural system, which is of course vital to us for our nutrition, there are also many One Health issues related to this. So soil degradation and pollution. We have antimicrobial resistance because of use of antibiotics, pesticides, and also food contamination, so a disease risk posed by food. So a healthy environment requires also a healthier agricultural system. And then finally, and this is something that is close to Robbert's own research topic, a healthy environment is a green environment. Because exposure to green space is more important than we may think. We can be exposed to green space in different ways. For example, we can be really out in nature, so exposure with contact, but we can also see nature through a painting or through a window. So this is exposure without contact, and also really connectedness more on a spiritual level with green space. And this has several benefits. So it builds capacities, so it really enhances our physical well-being. It enhances the immune system to be out in nature. It also restores capacities, so it reduces stress and it brings back our attention. So it's a good break when you're overworked to go into nature for a while. And it also reduces harm. So we've seen these regulating factors of the environment. It can filter water. It reduces heat in an urban context, for example. So there's many benefits to green space. And this has been shown to improve our health and well-being. So really a measurable difference in our mental and physical well-being. Lower medication sales, for example, in a study in Brussels, it has been shown that there was a correlation between places where there was a lot of green space with lower sales of medication, both painkillers, but also medication for mental well-being, and a lower risk for depression, stress, and mortality. So Robbert concluded this presentation by saying that a healthy environment is clean and green. Then I would like to close this presentation with a final thought. So you may have heard of different definitions of health. So when we think about the human population, we think of public health, global health, meaning a specific focus on lower and middle income countries. Then we have One Health, at least in this representation of the different types of health, and then planetary health. So this may beg the question, is One Health plus an extra focus on the environment, does this mean planetary health? These terms have been used quite interchangeably, and there's definitely many different representations of both of these terms. And I don't want to get too caught up into definitions, but I've put the definition of the Rockefeller Foundation and Lancet Commission on Planetary Health here. So the concept of planetary health is based on the understanding that human health and human civilization depend on flourishing natural systems. So in a way you could see planetary health as more of a human-centric view on One Health or on health. So in my opinion, and these are just the definitions of course, One Health is a bit more all-encompassing than the definition that they have put here for planetary health. Because we as humans, of course, have the tendency to focus on our own health. Of course, this is not strange. We are the ones who have the most responsibility of polluting the environment, of creating climate change. So we are also the ones that fund the research programs with our tax money. So there's, of course, it's only natural that there's a focus on human health, but we definitely should not forget that also the environment and animals really deserve protection because of their own sake and not just because of what they could mean to human health as well. So with that thought, I would like to close this presentation and thank you for your attention.
Thank you, Robert.